Okay guys, this is going to be your week 1 instrument list for this mod. So the first thing we have on here, number 1, is your irrigation device or suction irrigator. Any of those three would work for your quiz. This has a filter on it. It hooks to the Neptune suction unit or suction container like we have in our lab, and then they can put fluids through this, they can drain, they can do all kinds of things with this. So this is your suction irrigator. Number 2 is your GIA stapler. Okay, so this is an endoscopic stapler that they will use. Okay, when you use this, I'm trying to do this one-handed. You will go on there, and sometimes your circulator will open it for you. And I'm gonna turn this camera around, I think. Hold on. When you take these staple loads out, you can pop them on the table. Push this down on like your mayo stand, and it will pop the staple loads out. If you are using a GIA stapler, they'll go through laparoscopically through the trocar, and they'll staple. They can staple down the stomach line, they can staple anything really. Those staple loads that will be, if you're using this GIA stapler, the staple loads will be popped onto your table, and they are a counted item. Okay, so the third thing that we have is the laparoscopic Bovie cord. So this is a laparoscopic Bovie cord. You can hook this to the Bovie machine. This will hook to your instrument, your laparoscopic instrument, and you can coagulate with it. Like if they wanted to use the nerve hook and they wanted to go through certain tissues or whatever, or if they wanted to use a long-tipped Bovie hook, if they wanted to use one of the bowel graspers and kind of coag, they could do it with this. Okay, so that is number 3, your laparoscopic Bovie cord, and that's how we would want it on the test, to say laparoscopic Bovie cord. Third is your endoscopic Ligaclip applier. This is just like the Hemoclip applier, but we use it in laparoscopic or endoscopic surgeries. Just like that. Number 5 is insufflation tubing. So if you look at this insufflation tubing, it has a filter here. This is the clear indicator of how it looks different than your normal suction tubing. It has a connector right here. It has this filter, and this will be insufflation tubing. Okay. Number 6 is your fiber optic cable or fiber optic light cord. This has 2 ends. This along with your insufflation tubing will be passed off to your circulator. So they'll take this, you'll connect it to your scope on the side right here. It connects just like this, so that when that light comes through the scope, and you can see it through the end of the scope. So fiber optic light cord. Number 7 is going to be your endoscopic catcher or your endo catch. So this is the bag that I showed you guys the other day in the lab. They'll put this through the trocar, and they'll pull it up so that it cinches closed, and they can pull the specimen out through the trocar that way. If it's something larger, like if they're doing a laparoscopic sleeve and they're taking out part of the stomach, or they're taking out the appendix, gallbladder, they can put it in this catch bag and pull it right out in one piece. Number 8 is your endoscopic camera or camera head, endoscopic camera head. So your scope attaches here based on whatever size they want, 5 millimeter, 10 millimeter, whatever. And then this is how you white balance, and we'll show you this whole setup in the lab, how to do that. So your camera head, endoscopic camera head. Number 9 has 2. So these are scopes. These are 5 millimeter scopes. You've got a 30 degree that has an angle, See that angle? Let it focus. And then you have a 0 degree. 5 millimeter, 0 degree, 30 degree. On the test, you will have to say this is a 30 degree 5 millimeter scope or a 0 degree 5 millimeter scope. Number 10 is a 10 millimeter scope, and it is also a 0 degree, as you can see, because it's bigger. See, 0 means it's flat. And again, this is where your camera head fiber optic cable would attach for the light. All right, number 11 is going to be your Gary, or some people call it an igloo. So you take that out, you put your scope in here, and that's what defogs it when it gets fogged up, because inside the peritoneum can get a little foggy. And this is a counted item, and it's counted as 1, 2, 3, the tampon, 4. Counted item, that's Gary. Number 12 are trocars. These are 10 to 12 millimeter trocars. When we have these trocars, we put them in the body, and then this anal cannula will come out so that the instrument can go through that port. Number 13 is also a trocar, but it is a 5 millimeter balloon. See that little balloon there? That inflates with the syringe. So this is where they'll put that syringe in to inflate the balloon. 5 millimeter trocar, balloon trocar. 14 is just a 5 millimeter trocar. See the difference? But again, even with a 5 millimeter trocar, this inner cannula will come out. All right, 15 is your 10 to 12 millimeter balloon trocar. So here's your 5 millimeter, here's your 10 millimeter, both balloons. Got that little balloon at the end with the syringe on it that will pump it up. See how it pumps up that balloon? And then they'll deflate it before they take it out. 16 is what we call a Hasson, or some people call it a gel port, but we always know it as a Hasson. Here's where your gas plugs in. Again, the inner cannula will come out. If you use the take down method, you will use, this won't be on the test, but this is for your knowledge, you will use a 0 Vicryl on a UR6 on the Hasson. So anytime you have a Hasson trocar on the field, you'll have your 0 Vicryl with on a UR6. Number 17 is Fred. Fred is another anti-fog, just like Gary, but sometimes they want to use the Fred instead of Gary. This is also a counted item. You count it as 1, the cap, 2, the bottle, 3, the sponge. They'll take this cap off, they'll dab some of this on there, and then they'll put the camera scope end on there to defog it. A lot of times what your surgeon's going to do is they're going to just put this right on the field, like we do our scratch pad for our bovie. We'll put this right on the drape somewhere so they can easily just do it, and then you'll just take this off the back table and moisten it as needed. Number 18 is a Verus needle. So we'll use this Verus needle for our insufflation with the gas for the pneumoperitoneum. They'll pop this through, usually like through the umbilicus, and you'll hear 3 pops, pop, 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 as it goes through the layer, and then that's what they'll use to develop the pneumoperitoneum. So Verus needle. 19, you should know, well, you've already seen this. This is an S retractor, so I'm not going to say much about that because you've already seen it. 20 are suture passers. So you can have the straight one or this one. You'll put your suture on there and you can pass it through the trocar to get it where you need. They'll put the suture on there, they'll pass it through the trocar, and then of course they'll begin suturing inside the body. So suture passer is number 20. 21, pull suction. Now you've seen a pull suction that we use that has the pieces, or ABD with guard. Well, this is a endoscopic or laparoscopic pull suction. Still has your opening at the end for suctioning, but we can put this inside the body and drain it that way. 22, suction aspirator needle. So that's what this is, suction aspirator needle. 23 is an L hook. Okay, so this is where we can use, and you can connect it to that cord, the laparoscopic Bovie cord, and it has a 5 millimeter diameter, but this is an L hook. It's pretty easy because they do come in different sizes, but you can see right there why it's called an L hook. 24 is your suture knot passer. Okay, so what happens is they're in surgery and they're sewing and they see the knot and they need to pass that knot off, and this kind of has a hole in it at the end, so you can grab that knot and push it down if needed. Suture knot passer. All right, so let's talk a little bit about your graspers and instruments that you're going to use